Soft tissue sarcoma is a malignant form of pediatric cancer that forms on soft tissues like fats, muscles, or blood vessels. Rhabdomyosarcoma is the most common type of soft tissue sarcoma in children and is more prevalent in young boys during growth spurts. This type of pediatric cancer affects children with immune deficiency syndrome as well as children who previously had radiation treatments. Children have a better chance of being cured than adults.
A sarcoma starts off as a painless lump, but as it grows, it pushes on other nerves, organs, and muscles and causes pain and dysfunction. Due to limited space to grow, it weakens the soft tissue that is infected and causes healthy cells to die off. These lumps are more common in legs and arms. However, sarcomas that starts in the abdomen may cause people to feel pain or a sense of fullness. Different symptoms occur depending on where the tumor starts.
A diagnosis of sarcoma is made by clinical examination, physical examination, biopsy, or imaging tests. A biopsy is often used by taking a sample of the infected area to test whether the tumor is malignant or benign. Imaging tests show pictures of the inside of the body and can show the stage the cancer is in and if the cancer has metastasized.
The most typical treatments for children with soft tissue sarcoma include surgery, chemotherapy, and radiation. Surgery helps remove the known tumors from the tissues. Another treatment is radiation. Radiation is done prior to surgery to try and give easier access to the tumor and better margins. Radiation helps destroy cancer cells. After surgery, radiation is done to help terminate any remaining cancer cells. Chemotherapy is also a useful type of treatment. Chemo is used to cure, control, and palliate cancer cells.
Sarcoma has no risk factors or preventive strategies to keep someone safe from soft tissue sarcoma.
At Johns Hopkins, Laura M. Fayyad is conducting research to see how soft tissue sarcoma tumors react to chemotherapy before removal. As of right now, there is no way to tell if chemo is working properly. However, if researchers discover a way to tell if treatment is not working, it would allow for higher and quicker success rates. It would also allow for a better understanding of their patient's progress.
My cousin Tucker was diagnosed with soft tissue sarcoma when he was 2 years old. The cancer attacked his ribs, a lung, and one side of his face. During his initial diagnosis, the cancer was rare, and not many children had it. During this whole process, he, his family, and several doctors were very hopeful for his survival, but one of the hospitals he went to said that there were very slim chances. When he had his cancer, he went through a stem cell transplant, chemotherapy, 77 radiation treatments, and a surgery of which removed a rib. He relapsed 3 times. Tucker is now 16 years old and is 10 years cancer-free.
York Suburban hosts an annual mini-thon to raise money for the Four Diamonds Foundation. Four Diamonds raises money to support affected families and to fund research to help find a cure for childhood cancer. We mini-thon for the kids.
For more information about soft tissue sarcoma, visit the American Cancer Society or the National Institute of Health. If you'd like to help, visit the Sarcoma Foundation of America or SuperSAM to see how you can make a difference in the lives of children with soft tissue sarcoma.